Hello, I'm Heather Saylor, and I'm doing my PowerPoint on becoming a surgical technologist, which I plan to accomplish in my 2 years associate's degree. Working with others. Surgical technologists work as part of the surgical team. They go by many different names, such as surg tech, operating room tech, scrub tech, or surgical assistant, but regardless of what you call them, they play an important role in the operating room team. A surgical technologist is a scrubbed, gowned, and gloved participant in surgery who prepares and passes instruments, supplies, and the necessary equipment during a surgical procedure. This individual has an understanding of the procedure being performed and anticipates the needs of the surgeon. Life in the operating room can be hectic and demanding, with life-threatening emergencies often occurring despite hours of careful planning and prep. The surgical technologist must anticipate the needs of the patient and the surgeon to ensure that each operation goes as smoothly as possible. The surgical tech may also be asked to prepare the patient by cleaning and possibly shaving the incision site. Surgical technologists aren't expected to work miracles, but must be able to think quickly on their feet in emergency situations. Task to prepare for surgery. The surgical technologist is the first person to enter the operating room before surgery. During this phase, the surgical technologist adheres closely to the following routine. Carefully dons his or her operating room attire, scrubs, gowns, hair caps, gloves, and preventative shields. They begin to prepare and sterilize the room, gather all the equipment and surgical tools that the surgery requires, sterilizes, counts, and carefully arranges all of the tools and may even set up a log to keep count. They assist the team in donning their operating room attire, and they help in draping the sterile field. The most important part of this phase is creating and maintaining the sterile environment. Sterile fields can be compromised in a variety of ways, but the most common is introducing moisture. To prevent this, the surg tech is responsible for arranging dry drapes around the operating table and keeping all surfaces in sterile condition. During surgery, the surg tech is still responsible for maintaining the sterility of the operating room, but they also effectively become a third hand to the surgeon in assisting during the procedure and performing many different tasks. Tasks to prepare during surgery. They must help prepare medications and administer to patients, assist in retracting tissues from the patient, pass the surgical tools to the surgeon during the operation, and many times may be asked to hold organs in place or use retractors. Anytime during an operation, if a tool is missing or contaminated, the delay or resulting infection could cost the patient his or her life. This is why surgical technologists must be diligent and thorough at all times. Tasks after surgery. Counting all the tools and instruments used during the surgery and to ensure nothing is left behind. They must suture the incision and apply disinfectant dressings to the area. Dispose of items such as needles and gauze and continue to remain in the sterile environment until the patient is sent to the recovery room. Certification can help a technologist find the right position. You can earn various types of certifications such as Certified Surgical Technologist, Tech in Surgery, or Certified Operating Room Tech. Advancements in technology have made surgery safer, and as the aging population requires care, surg techs will be ensured steady work. Prospects are best for those who completed an education program and who maintain the professional certification. This position will keep you on the move all day long, and no 2 days are ever the same for a surg tech. The advantages of surgical technology. It is one of the fastest rates of employment. There is a very high demand for surg techs. It's very rewarding and fulfilling being able to help people and get over their illnesses. It has good pay, versatility, and a potential for job security. Some of the disadvantages of surgical technology are how you have to stand on your feet for 8 to 12 hours of constant moving. You may have to work through your lunch with things being so hectic, you never know what's going to happen next, who you're going to have to be helping, or what you're doing, and you might not have time to sit down and eat. And it can also be stressful with the constant motion and all kinds of things. Employment can be found in hospitals, physician offices, outpatient, some veterinary offices, commercial sales, management, and education. Is surgical technology rewarding? I believe it is, because we touch the lives of people every day in many different ways. And every day brings us a new adventure. No surgeries are ever the same. Even if it is the same exact surgery, the patients are always different and the conditions are always different. So you never know what's going to happen next. And surgical technology is very exciting and rewarding. Well, I'll be required to complete additional training once I become certified. Continuing education credits are required once you have become certified. You must obtain 15 credits every year or 60 in a 4-year cycle. Thank you.